Welcome to the lighter side of the spectrum, the podcast that celebrates the multiple hats we wear and the juggling acts we perform in life. Whether you're parenting kids and teens on the autism spectrum, navigating the ever-evolving healthcare industry, or building a more inclusive and impactful world, this is your space to find connection, inspiration, and growth. Together, we'll share stories, tackle challenges, and explore how innovation and inclusion create better outcomes for everyone. Because no matter the spectrum, there's always a lighter side. Now here's your host, David Kaufer.
Hello again, everybody, and welcome back to the lighter side of the spectrum. I have a question for you. What if the most honest thing a health expert could say to you was, I'm not 100% sure? How refreshing would that be? In today's culture of hot takes and absolute claims, that kind of humility might be the most powerful truth of all. And we're going to talk about that today. My guest today is Alex Morozov. Did I get that right? Alex?
Mm-hmm.
Okay.
Yes,
All right.
Thank you.
All right. Stop stressing about it. Alex is a physician scientist and advocate for evidence-based thinking. He's also one of the co-authors of a widely shared MSNBC op-ed dismantling RFK Jr.'s recent claims about aluminum in vaccines. And that's how I discovered Alex. Actually, I read the article. It was very well done. Alex is also the founder of Eviva Partners, a nonprofit dedicated to helping people understand how to find and interpret evidence, especially in an age where trust is in short supply and certainty is often used as a weapon. So we're going to talk about gray areas, trust, and again, why it's okay to say we're not sure. So Alex, welcome to the show.
Thank you so much, and thank you for inviting me. I was so excited when you reached out, it was also such a pleasure to talk to you now twice and to hear your story and your son's journey, and I'm really looking forward to our conversation.
Yeah, we've had the benefit of having a couple of great conversations. I reached out to you, like I said, after that article, because I just thought it was so well done in terms of kind of outlining evidence and kind of connecting the dots in terms of why these claims are being made, kind of what the motive is behind it. It's not something I've talked a lot about on the podcast, although we have had a couple. Dave Yas, our producer who you've met, who'll be joining us in a little while, he and I did an episode kind of talking about RFK Jr., particularly in the aftermath of his infamous press conference and all that followed here. But just for the sake of our listeners, why don't you kind of give a little background, because again, you have a very, I think, impressive and relevant background that you bring to this conversation.
Yes, absolutely. Thank you. I really had a big career pivot last year that I'm very excited about. I in a way, I feel now what I'm doing is more impactful than anything I've ever done.
Wow. And that's saying
life.
something given what you've done.
Well, but it started perhaps as a somewhat traditional path. I trained as a physician, scientist, so I'm sure your listeners know there's this combined MD PhD program where for physician scientists. So that's what I did, and got interested in cancer, and so trained as an oncologist, and during my training, I realized that we need better medicines for our patients, I then learned of the pharmaceutical industry as a career option for people like
Right.
a friend who went to Pharma, and he then ended up recruiting me when I finished my training, and I loved it. For the first, dozen years or so, I got to do. I got to work on so many clinical trials, over 200 clinical trials according to my count, and
Wow.
multiple types of cancer treatments across various types of cancers, and even worked on about a dozen new approvals, so new treatments and combinations, and working with health authorities around the world.
And primarily in the field of cancer, Alex, again, specializing in that. So
Yes,
yeah.
primarily.
So these are helping people who are battling different forms of cancer.
Yes, exactly. And it was, to your point, it was very impactful work. Seeing
Yeah.
breakthroughs, and I witnessed kind of the birth and the peak of the immuno-oncology era,
Right.
when and I feel that people may not be aware of some of the big advances that science and medicine has made. We sort of hear about new cancer treatments
Yeah, I agree.
being
Yeah.
developed, but when we think about the numbers, it is just so striking. Metastatic melanoma was a death sentence practically, within a year.
Okay.
Now
Yeah.
we talk about the tail of the curve. So when you look at the curve where you start out with 100% people, 100% alive,
More-
and then it used to, within a year, it would drop down to zero. Now you have
okay.
something like 30% of patients who are long-term survivors. Long-term. And we never want to use the word cure.
Right. Yeah, that's always bothered me, because it's like, how you can't say that. Like, I mean, yeah.
Yeah, but it's just incredible witnessing that and being a part of that, and I also got interested in technology and AI and how we can do our trials better, cheaper, how we can be more inclusive. We
What do you mean by more inclusive?
Yeah, no, that's a great question, and I tell the story of my daughter found a box of Zepbound in the refrigerator, and she said, "What is this?" And so this was my the GLP-1 treatment, the weight loss, that sort of
Oh, okay. Yeah, gotcha. Okay. I was
like
trying to figure out what it was too,
Ozempic,
but I
etc.
figured you would get to it. Okay, yeah.
Yes, like Ozempic, etc. That
Yeah.
now has really revolutionized treatment of high cholesterol and diabetes and obesity, etc. And we started looking at this, and I pulled up the New England Journal paper,
Yeah.
and I showed them, I showed to my family, look, there is look how much benefit you can see here, that there's even appears to be an improvement in survival. The people are actually living longer, the people who take this medication. And she said, wait a minute, what is this graph? It's saying that 80% of the people in this study were men. What
Right.
about why is that? So and why don't they have 50-50? And this is just
Good question.
and so what this means is, if we don't do the trial in an inclusive way, if we don't include a representative population, then we cannot make conclusions about the people who are not in the trial.
Absolutely.
We know that sometimes the benefit is not equal. So, if we do a trial in prostate cancer, but it's all, we don't have any African Americans
Right.
in this trial, and we know this disease is very common in African Americans, it will be hard then to apply the results. So this is something we thought about a lot, and the FDA actually had a whole program on diversity in clinical trials, which unfortunately was shut down.
Of course.
The new administration, which is
Of course.
one of the many harmful things. So these are the types of things that we were working on, and then I decided to write a book about what I do, about clinical trials, and then I thought, well, clinical trials is not really the whole story. It's only a part of the story. What if we want to, look at, risks of, cancer, or, whether certain things in our food are causing disease. I mean, those are not clinical trial type questions. Those are more, there are research questions, but not trials. And so then I thought, how do I broaden this? And I thought, then the word evidence came to mind. And I thought, it's really all about evidence, ultimately, at the end of the day. But what is evidence? I realized that, if somebody asked me to define it after spending, a dozen years generating evidence, I still realize that I still don't know what it is.
It's really hard to define, right? It's kind of like, when you had mentioned that before, it reminded me, this is an old reference to a book, Zen and the Art of Motorcycle Maintenance, where there's the pursuit of quality. What is quality? How do you define quality, right? Like it's kind of along those same lines.
Yes, exactly.
But what is evidence? Because it means something different to a lot of different people.
Yes, exactly. And it's and I'm not alone. First of all, we tried to do a survey, an online survey, and ask people, have you ever discussed evidence with your doctor? And we couldn't do the survey because most people said, I don't know what you mean. Evidence is like on Law and Order, when you trying to prove that somebody committed a crime. Why would I discuss that with my doctor? So it is just shocking how we forget. We use this terminology. Some, academic goes on TV and says, we'll have very good evidence that vaccines are safe and effective. And most people have no idea what they just said because they don't know what evidence means.
Right.
And actually, even our dictionaries don't help, because if you look in the dictionary, very often you will see evidence is proof. And then if you look up proof, it says it's evidence. So it's sort of creates
like you
this
kind of point to each other, right?
Yes. But actually, the correct definition is that evidence is the justification for your beliefs. If you believe something, then the idea is not to stop there, but to say, why do I believe this? And that, and unfortunately, we often don't do that. We don't do that enough. So it's not really just about a word. It's basically like a whole way of life.
Right.
So how to this idea of questioning your beliefs.
I was just going to say, don't you think that kind of goes along the lines of just critical thinking? I mean, kind of having the critical thinking skills, The ability and the willingness to question things and to look below the surface and, to ask though, why, why is it this way? How did we get to this point? I mean, it's kind of it's digging below the surface, which takes work, right? A lot of times it takes a little more effort. And a lot of times, frankly, it can be uncomfortable, depending on, like you said, where you're coming from.
Yes, yes, exactly. And it's not intuitive to us. This is something that is not
that's a good point.
natural
Right. Yeah.
Because this kind of gets into this discussion of uncertainty. We and like you said at the beginning, as scientists, we know this intuitively that you never really know anything for sure in this world. You just don't. And so proof really doesn't exist in the real world. It only exists in math.
Right.
And in math, you don't need to talk about evidence. You don't say, we have evidence that 2 + 2 = 4. It just does. And you can prove it.
Yeah. And you literally have proofs like this. It's built into the system. You have proof. I mean,
yes. But when you are starting to talk about the real world, if you're talking to someone who believes that the earth is flat, which actually a large number of the population, something like 10% of people do.
10%?
Yes.
Oh my God.
Even higher in some countries. And I think, but why does this happen? Because there's no proof. You cannot prove to someone that the earth is round unless you take them up into space. Because you can always say, well, there's a giant conspiracy and NASA
right.
taking pictures, etc. And I cannot prove to someone that there's no conspiracy at NASA.
You can't. Well, I guess maybe it's semantics. So I guess you could say you can prove it. You can offer the proof or offer the facts or offer that, but you can't force them to accept it or to acknowledge it. Right? What you could give people facts and information, as we've seen time and time again, especially in this era. And they could just, like you said, have a wall against it and just say, it just kind of like bounces off of them or whatever, because they don't want to accept it. You had mentioned that before too.
Yes, exactly. And but to me, a much healthier way to have this conversation is to frame it in terms of evidence rather than proof and truth. Because if we start searching for truth, then it becomes a question of, well, I have the truth and you don't have the truth.
And you don't have
truth
it.
is better than your truth.
Yep.
I know that the earth is round. I've proven it to myself. So if you think it's flat, then there's something wrong with you. And the other person thinks, no, there's something wrong with you. So the way so this concept of truth and proof, I feel like gets us into kind of a dead end where we just end up endlessly arguing. Instead, what I am proposing, and is a very simple thing.
All right. Yeah,
I love this. We have in our heads is a scale like this, right?
A scale. Yeah. For listeners, Alex is holding up like a real scale, like
a scale with 2 cups that I got on Amazon with a little bit of
with a little weight. The weights kind of like I said, kind of remind me of the old grocery stores when you actually would have the weights and you would weigh fruit or whatever.
Exactly. Yes. And growing up, I used to love playing with those, and we use them in school. It starts with the big one and goes down to a little tiny one that's not even it's like a little flake of metal that you have to pick it up with the forceps. And so that's what, so when scientists say the weight of evidence, overwhelming evidence, the balance of evidence, the preponderance of evidence.
Right.
They imagine this scale, and they never use the word proof. So if you look at
The
a
weight of
scientific paper,
evidence.
they will never say, and therefore I have proven that this vaccine is safe. They just never say that. They say we provided strong evidence. We provided, the benefits outweigh the risks. Again, we're always talking about these weights, and this also helps explain that evidence can change over time.
Right.
The proofs don't really change because Euclid was one of the first mathematician who started proving things in ancient Greece, and
Yep.
and we don't go back and we don't revisit those proofs. We don't debate them on social media.
Right.
But evidence changes, and
Absolutely.
so the things that they thought about the natural world back then, what causes thunder, and we've come a long way since then. So science evolves, and
And it still is evolving. I mean,
Yes.
it continues as for all the progress, incredible progress, right? That's been made, particularly
Yes.
over the last 150 years, it still continues to evolve and change, and views change, or, depending on new evidence that's provided, that sometimes that changes perceptions about certain situations, or
Yes.
previous beliefs about lightning is one of those examples, right? Like,
Mhm.
we still don't, my understanding is, like, for all the studying that's gone on, there's still not 100% certainty of, like, how the hell it works. Like, where you like,
Yes. Yes, exactly. And the bicycle, that's something. This so one of the things that I talk about in my book, which, by the way, I'm still working on, but I cannot finish it soon enough. But this idea of how something works, is that evidence that it actually works? And I now strongly believe that understanding how something works is absolutely in no way should be considered as evidence that it actually works. So,
Right.
for example, we don't. I don't understand how my phone works. I don't understand how my TV works, but that doesn't stop me from using. I clearly know that they work, but at least for the engineers who built them, they know how they work. But the bicycle, we still do not fully understand how the bicycle stays upright, because those
Really?
ones got so complicated that the mathematicians basically got stuck, and they said we cannot solve those equations. So to this day, if you look it up, you will see the mathematicians and the physicists to this day cannot explain how the bicycle works. But we know that it works. But on the flip side, if you
That's
remember
interesting.
the perpetual motion machines, this was like the craze in, I think, the 18th century or the 19th century. People were inventing perpetual motion machines. Like, if I have the ball that it starts over here and then it magically ends up back here, and then this thing will just go on forever.
Right.
And they patented. There were so many of these patents that were issued, where eventually the patent office said, "We're not doing it. It's impossible. We're not doing any more patents," because each one explained exactly how that thing was going to work, except none of them do. We know that. Eventually, they all stop. So that's why I actually think it can be very dangerous to think too much about what we call the mechanism, or how this particular medication works. We love to talk about this, and my people ask, this is the patient's favorite. We actually did another. This is another survey that we did, was to ask people, when you talk to your doctor, do you talk about how the medication works? Versus, do you talk about, since we couldn't use the word evidence, we basically said, Do you talk about the side effects that it has? Or what percent of the patients get better on this medication?
Right.
And
Right.
it turns out that something like 80% of the time, people talk about the mechanism, and
How
only
it works.
something like 30% of the time, they talk about, does this actually work? And how many people does this help? If you take 10
Interesting.
people, how many of them will actually be helped by this medication? That's what I want to know. How this works. The scientists who are going to develop the next medication, they definitely need to understand this. But for me as a patient, I don't need to, because I know that it's just what we call hand waving. Oh, it's an
Yeah.
anti-inflammatory, it's an antibacterial, it's an antioxidant, it's a antioxidant, it's it's all just really a guess. And in fact, sometimes people use this kind of mechanism fancy talk as a way for covering up the fact that we have actually no idea that this works.
Right.
It's gonna blow
yeah.
up the smoke and tell you about the
Well,
mechanism.
it's kind of it's a marketing trick. And I
Yes.
I can say that as a marketer, right?
Yeah,
smoke,
exactly.
smoke and mirrors are a real thing.
Yeah.
So tell me how kind of fast forward a little bit and then talk about so how has this all played into the op-ed that you wrote, and kind of what your motivation was for writing that piece and because I want to talk about again this era that we're in, kind of why we're in it and some of the dangers of what we're facing right now.
Yes. No, that's a great question. So, as I started working on this book, I I was working on a chapter about indigenous medicine, and again, I realized I don't actually know what indigenous medicine is, and how do I make sense of indigenous medicine versus Western medicine?
Okay. Yeah.
Oversimplify. Does it work?
Does it work? Right. You
And
start there.
Yes, and this was my very naive sort of starting point.
Okay.
I met in this journey a remarkable person. His name is Elder Marshall. He's a First Nations elder in Canada, in Mi'kmaq First Nation that is centered around Nova Scotia. And I had an honor of meeting him twice. He developed this concept of two-eyed seeing. So
Of what was that again?
with two eyes.
Two eyes. Okay.
So in other words, you're seeing one perspective with one eye and one perspective with another eye. And this is a concept that has a long tradition in the Mi'kmaq culture. And he applied it to knowledge in general. So you're seeing Western medicine with one eye, and you're seeing indigenous medicine with another eye.
Yeah.
And you're taking the best of both.
Yes.
It's a very respectful approach. It sort of reminded me of my scale, because there's no truth. You don't have to search for proof and to say, you're right, you're wrong and I'm right, and which one is better. It's such an inclusive, respectful approach. And when I met with him, he said, "Don't just write your book. Let's do something about this. How are we gonna explain this to people? How?" And so, and I was at that point, I was already thinking about leaving Pharma, and he gave me this motivation to start a nonprofit. And I called it Eviva. I wanted something that starts with Evi for Evi.
Yeah, I just figure I just I'm a little slow, but it's funny. I just as we're talking, it's like, oh yeah, now that makes sense.
No, but I actually this time I did not spend. I had some ideas for startups in the past, and I would spend way too much time thinking about the name. This time I just said, you know what? Those didn't work out, even though they had great names. This time I'm just going to pick a name and just go.
Yeah.
But it ended up being, I think it works in different languages. And I invited Elder Marshall to be on the board, as well as Gordon Guyett, who is the founder of evidence-based medicine.
Okay.
And actually,
Yeah. They're both on your
HR.
website. I saw,
Yes.
right? They're listed on the website.
Yes,
Right?
yes. And Steve Lewandowski, who is an expert in cognitive science and how people make decisions, how people fall for conspiracy theories. Why is it that 10% of people believe the Earth is flat? How is that even possible? And how? Steve actually is developing an approach that, in a way, is similar to two-eyed seeing. It is like a more scientifically validated version of two-eyed seeing, which is a way for a patient and a provider to have a conversation that is a very respectful way to have a conversation. I was so excited it was coming together. And the idea was that we were going to try to explain, try to explain some of these complicated concepts. How do you think about evidence? How do you make decisions? How do you, for patients, how do you talk to providers? For providers, how you talk to patients? It's not just about the patients. The providers very often are too busy, or they just don't know how to explain things. So they just, you just got to do this, okay?
Yeah.
Just do it, okay? and that obviously that doesn't work. So that was our plan. And then when Kennedy was appointed as the Secretary of HHS, it was sort of a wake-up call for us.
Okay.
First of all, we realized that our work became even more important.
Right.
But it also became much harder for us. And that's what, so we've basically, decided to take a step back and think about how we can reach the broad public, and how we can serve as this sort of this voice to empower people.
Yeah, a voice of reason.
A voice
I
of
would say.
reason.
Yeah.
And a way to empower people to make better decisions, to tell science from pseudoscience.
Okay.
How to make sense of this confusing time. And I'm purposefully not using the word trust, because trust is not our goal. We decided that we're going to approach this in a different way. I'm not a big fan of this concept of trust. I would caveat it by saying trust but verify. But happy.
Stone's happy.
Happy. Hi, Stone.
Alex says hi, Stone. All right, he's out of here. Makes his appearance. So you're talking about trust.
Yeah. So it's I prefer this concept of empowerment, because trust becomes very confusing very quickly. Who do you trust? Do you trust? Trust science. Well, which science? Now we have different kinds of science. We have the old science, we have the new science, we have the gold standard science. Trust your doctor. Well, do I really want to trust my doctor 100%? What if this doctor is racist, sexist? What if they made a giant mistake? What if they're too junior? What if they just came out of medical school? What if they're so old that they forgot Or maybe they went to medical school
Or
50 years ago and they
right,
never
right,
learned the new way of doing things, right?
right.
So this
Yeah.
idea, just go out there and trust the person in the white coat, or trust the government. Um, to me, it's also sort of a dead end. I think we need to empower people to um, to and it doesn't mean that they have to make every decision themselves, but they need to be empowered enough to know who are the trustworthy voices. And maybe I can decide this provider is trustworthy, but I'm going to keep an eye on them, and if they say something that doesn't make sense to me, then maybe I will challenge them. I will ask for evidence. Why are you saying this? What is the evidence that you're basing this on? And but it's a long road. It's not something that can be done overnight.
No, no,
Yeah.
it's definitely a long road.
Yes.
I mean, I would love your perspective. I think I can't remember if we talked about this on
Mhm.
your pod
Mhm.
or not, but kind of again how the healthcare system mishandled kind of some of the messaging around vaccinations, especially when some of the questions first started coming up. Years ago. Again, I think it's fair to say, at least from a personal standpoint, like Jenny McCarthy, of course, popular, wrote a book and used her fame to get the message out. Again, people could argue for better, for worse, whatever. Something that I believe initially she, something that she believed in, and she went out there and like I said, had her messaging, and I think, I think that woke up a lot of people. You could say, or woke up, or just that made them aware. Okay, and this is my perspective, just speaking as a dad, because again, I was like in the heart of it. This is right when it was literally her appearance, I think, on Oprah, when she was kind of giving advice in terms of like when to seek a diagnosis for your child if you suspected, which is like we were right there. And she kind of gave a list of, do they not make eye contact, blah blah blah. And it was like in my case, check, 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 right. And we went, and sure enough, the rest is history. But to my point, so there's this awareness that bubbled up, right? Early days of the internet. And instead of, taking a look at it or however, I think that there was just such a strong and immediate blowback, or just this absolutism of like, it's quackery. Like there's no way, like this is just ridiculous. She's just an actress. What does she know? Like there was so much pushback that there was kind of like it got to the point where, like I said, there was less of a discussion about the possibility that there can be injuries, that there can be, side effects from vaccinations, just as there are with any other medical medications, for, pharmaceuticals. Nothing is perfect. And I think that there was such a strong fear. I felt like that to admit that, yeah, there could be, there could be vaccine injuries that come out of this, that it kind of all of a sudden, got to this black or white position. But again, that's my perspective. Again, biased, being in the middle of that. I would love to kind of, again, someone who was in this field, but in pharma and train and as a physician, scientist, what your perspective is, kind of looking back over, say, like the last 15, 20 years.
Yes. No, this is. I'm so glad you brought this up, and I'm actually just really immersing myself in the history of autism, the history of the autism community, the parent
Right.
community, the activism, the treatments,
Yeah.
the maybe the emotions, the struggles. It is just such
The emotions.
a
Alex, that's I think that's so much of it right there.
Yes.
I think that's so much of it.
Hey,
Hang out. You're gonna hang out?
happy,
All right.
happy.
Go hang out.
Hi, Stone.
Yeah.
Yeah, and I mean, he clearly wants to be. He knows this is
Yeah.
we're
Yeah.
talking about autism, and he wants to participate.
Yeah. He loves it.
Yeah. No. And you know, I well, first of all, you mentioned, you know, my background in pharma and the struggles to sort of really, these are struggles against uncertainty, against, you know, chance. Chance was always our enemy. Right?
Mhm,
We would do a
mhm,
clinical
right.
trial, and then the FDA would say, well, how do we know that this just wasn't a random result? If we did this
Sure.
trial again, maybe it would come out differently. Maybe just by chance, the people who got the placebo maybe were sicker than the people who got your drug. And that's why it looks like your drug did better, but not because of the drug, just because by chance you
Interesting.
coin flipped this in such a way that you end up with healthier patients who got the drug. Maybe you just got lucky.
Right.
How do you know that this was not the case? And you know, and if the FDA didn't ask this question, then the Europeans would ask this question, the Japanese, the Australians,
Right.
the Canadians, the Koreans, you know, the scrutiny that we would be under would just be tremendous, tremendous, and prove to us that you planned everything ahead of time. Because obviously, like, you know, if you do 10 different trials and you pick the best one and submit that, right?
Right.
And look, this one looks great. Well, what about the other 9, right?
Yeah.
So that's why we have the registration system where every trial you do must be registered before you start. On
Okay.
clinicaltrials.gov.
Interesting. Yeah.
If you don't register it before it starts,
Go for it.
Okay.
Yeah.
what is he saying?
It's just like he's just stimming. He's just excited. He just likes to come
Okay.
in and out of my office, so he's fine.
Okay. You know, the journals now have a rule. They will not accept a publication from a clinical trial that was not registered.
Oh, okay.
Started.
Interesting.
Just to kind of make sure that people don't secretly do trials and pick the best one.
Pick the best one,
submit
right?
that and kind of burn
Yeah,
it
makes
out.
sense. Yeah.
So all of these things, and it was really an evolution for the FDA as well, in their thinking. But I always think about this story that I actually sort of start my book with, the story of Benjamin Rush. He was one of the first physicians in the newly formed United States. Was the one of the signers of the Declaration of Independence.
Oh.
He was a fighter. He was fighting epidemics of yellow fever.
Okay.
The Philadelphia area. And yellow fever had a 30% mortality rate, which it still does today. There's still no treatment for yellow fever. Just
Oh, wow.
if you don't get vaccinated, and if you get it, if luckily it's not really present in the U.S., but you know, if you go to a tropical environment,
Yeah.
etc., if you get it, there's no treatment. So imagine a disease where 30% of people die within 30 days and 70% get better on their own.
Right.
And here he was trying to figure out what works. And he decided that because of the humor theory at the time, the bad humors, he thought they didn't even know that it's spread by mosquitoes at that point. They were
Oh, sure.
so helpless.
Yeah.
People just suddenly get sick all over the place. It was a real, epidemic, and nobody understood why, what was happening, why it was happening, how to help these people. And he just thought, well, they have bad humors because they had fever, they were red, their heart was racing, and he thought they have too much of something in their body. Their bad humors are accumulating. Let me treat them with bloodletting.
Oh, right.
Would
Yeah.
you drain a bunch of blood, then the patient is no longer red, their pulse slows down.
Yeah.
And so he practiced extreme bloodletting. He said to the point that the patient faints. And he was teaching that. He was one of the first medical school professors in the US. He was teaching the students, you must remove, don't be afraid. Just do it until the blood won't come out anymore. Literally is what he said.
Wow.
And he also, speaking of mercury, actually, he was using mercury as treatment because
Oh, wow.
mercury was great because mercury toxicity causes salivation, tears, vomiting, diarrhea. He thought this is exactly what we need to remove the bad humors from the body.
It's a detox.
Detox, exactly.
Right.
With mercury.
Mercury
And he was
detox.
cheering them on, the patients. Look, you're doing great. You're just let those bad humors out.
Yeah.
This is depletion
Yeah.
therapy. Like deplete these poor patients of basically everything they've got, blood,
Crazy.
Wow.
Wow.
Diarrhea. And somehow he concluded that this stuff works because at some point he wrote in his diary, I have treated 100 patients with this depletion therapy and they all survived. Eureka, I have discovered the treatment for yellow fever. And actually, somebody relatively recently, went back and tracked down those 100 patients based on their
Wow.
records and the cemetery records. It turned out 30 of them died, just like you would expect. So there was no miracle. He got his math wrong. Maybe he got overexcited. Maybe he didn't know yet that they died, and or they
Drew conclusions a little
so
too
he
early.
jumped to
and
conclusions. But then,
yeah.
so this, and I actually then I worked with a brilliant, data scientist to do. Can we do some math on this? How many patients would he need to actually, if he found an actual cure, so that the death rate would go from 30% to 10%, let's say. He would
Okay. Yeah.
reduce the rate of death 3 times. How many patients would it take? And it turns out it would take like tens of thousands of patients. It would not, one lifetime, even if he saw only yellow fever patients for his entire life, it would not be enough time for him to be sure that something worked, just because of pure chance.
Oh, gotcha.
Better. You have no idea. Did they get better because you removed their whole blood, or despite the fact that you removed all of their blood?
Right.
And somebody else dies.
Did they eat something different? Were there other variables?
Yeah. So that is, and as we sort of learned this a little bit in medical school, like, do not, again, if you believe that something works, if you gave something to the patient and they got better, do not immediately jump to conclude that they got better because of the thing you gave them.
Yeah.
You could be wrong. You could be making that same mistake that Benjamin Rush made. And so that's where it becomes really, really challenging, because it is so hard Um, and we actually, scientists, we still have not cracked this problem. How do we do this? How do we actually figure this out? You can do clinical trials, but how many clinical trials can you do? I mean, these
Right.
trials are huge and they only get one answer at the end. Yes, no. I mean, that is so inefficient. Can we do
Yeah.
something
And then
else?
you
So
probably
that is-
have other factors at work too, Alex, right? I mean, the fact is, again, we could talk forever, but like, I just
Yes.
want to make the point that, there's the other variable I'm sure that plays a role here is that, the pharmaceutical companies are companies like they have a profit motive as well. And so like there aren't like you don't as a researcher, I'm sure there are limits in terms of how much resources, how much time and resources are available in these various areas for the different studies. How much time and effort are the companies willing to put into whatever it may be. And again, I'm sure it varies depending on the disease that, like there again, a lot of variables that go into that, but I'm
Yes.
sure that also plays a role, right?
Yes, yes, absolutely. So here you are, if you're a for-profit company,
Which they all are.
yes, and let's say you're publicly traded,
Yep. Which most of them
um,
are, I believe.
right?
Yeah.
And yeah, most of them are. People invest their pensions.
Yep.
I remember when I started working at Pfizer, um, our friends said, "Oh, make sure you do a good job because our daughter got this gift of a whole bunch of Pfizer stock from her grandfather, and so he put all his he really believed in Pfizer. He put all his savings
Oh,
in
wow.
Pfizer stock and left it for our daughter. So so I always used to think about those two, the patients and the shareholders who invest their savings in us. So yes, it's true.
Those are two different audiences. I mean, sometimes again, a lot of times what's good for one is good for the other. I mean, as we've seen,
yes, but maybe
relatively speaking, historically, I mean, a lot of, but not all the time. I mean, again, it's not 100%.
Yes, yes, yes. I think what worries me about your question about Kennedy and kind of where things are going
Yeah.
is that it seems that I think there's a risk that evidence could get lost. And the value of evidence, what actually is the value of evidence for us? For pharma, evidence clearly had value because to get treatments out and approved by regulators around the world,
You needed it.
you needed
Yeah,
to have evidence.
Right.
And even more difficult was the payers.
Oh, right. Yeah.
The payers, actually, the bar for the payers was even higher than for the regulators in some cases.
Sure. Yeah. They
I
had money at
remember
stake.
there was a discussion where the FDA and the European regulators they were doing a panel and they were saying, sometimes the pharma does these trials. They're actually bigger than what we want. We don't want them to do such a big trial. For us, a smaller trial would be enough. And why do they do such a big trial? And then one of the pharma executives came to the microphone and he said, why we do the bigger trials? For the payers. You guys don't even see that, but you may approve a drug. It may look good to you, but when the payers come in, suddenly, which is actually kind of sad, right? Then the payers
It is, right. Like this is a whole nother level.
Yes. So for all of those reasons, you kind of need evidence is like the biggest sort of currency that pharma would have, right?
Yeah.
As opposed to I have seen some of these sort of more aggressive varieties of the wellness industry.
Yeah, right.
You know, like for example, you know, spike support, right? They're selling these supplements, you know, because there's this idea that after you get the COVID vaccine, you have spike all over the place in your body, and you need to go.
Oh, yeah, I'm not familiar with that one.
Yeah, so that if you look on Amazon or Walmart,
Yeah.
they have all these the spike support. Um, do we have any evidence for that? No. But is that I'm really worried now. Is that the world that we want to live in? That you are just constantly bombarded from all directions by these remedies that don't have strong evidence behind them.
Right. And they're being pushed by a lot of cases, maybe influencers or, you know,
Yes.
right. It is a different world. Well, that's kind of a great segue. I told you we have a couple segments that we like to push. So the first one's our tip of the week. We have a little a jingle that we like to play first. So we'll play the jingle and then we'll offer a tip of the week.
Hey parents, gather around, it's time to speak. We're here with your tip of the week. Strategies and wisdom just for you. Autism parents, we know what you go through.
Okay, yeah, it's time for our autism, or just for this case, our tip of the week. And Alex, I don't know if you have any. I think we had talked about this before, but my tip of the week is kind of embrace the uncertainty. Again, we like to. I think it feels better if we feel like we have a known answer, but as we've been discussing, there's a lot of gray areas in life, in the journeys that we're on, particularly in the world of autism. If, you know, someone promises 100% certainty, or, you know, again, a black or white, I would take the opportunity to pause, you know, ask for the source, ask for the methodology, you know, do a little deeper digging, as we had talked about before. And I think it's okay to be skeptical. I think that it's wise. I think it's, you don't want to be skeptical to the point you dismiss everything, but to your what you were just talking about, I think you need to take that time to pause, and that's okay. Anything to add there?
I might suggest a book. Is it okay if I?
Yeah, of course. Yeah.
I've been reading this book called Pattern Seekers by Simon Baron-Cohen. I'm about halfway through it. It's just a fascinating book, and it essentially talks about the fact that autistic people are what made us human. It's who we are.
Interesting. Well, that's you know, like I said, we're gonna be pulling in Dave Yas in a little bit for discussion, because again, he kind of has an interesting theory along those lines we've talked about before. But before we do, we're quick fact or fiction segment.
Get QuickTime ready, and here we go. This is Autism Fact or Fiction. We're breaking down what's real, what's rumor, and what might surprise you. Let's go.
All right, now it's time for our fact or fiction segment. This is where I like to try to talk about either a stereotype or maybe you know, a thought that's out there, and try to say, is this fact or is it fiction? And so today we're talking about a recent Danish study that was released within the last couple of weeks. And did it prove that aluminum, I can't ever say that right, in vaccines causes autism? Did it prove it or disprove it, Alex?
Well, since we just talked about that, it's really hard to prove or disprove anything. I would say
Fair enough.
But it provided strong evidence that aluminum does not cause autism.
Right. And that's, yeah, exactly. And it was a large study, I believe 1.2 million, something along those lines. Interestingly, after that was released, RFK Jr. and his, you say former organization, Children's, right? They came out and, you know, again, tried to plant seeds of doubt, try to say, oh, there's some corrected data that may have skewed it, blah, blah, blah. But of course, they're the only ones who've said that. I mean, there's no other scientist, no other body that's come out to try to say anything along those lines. So, yeah, which again, I think it's a good proof point. Again, in terms of the body of evidence pointing to, it helps parents in terms of trying to make that decision.
Mm-hmm.
All right, so I want to introduce a new segment. We're going to call this Yas Talk, and this is when again I pull in our producer and friend David Yas to have a little bit of a discussion. Dave, you've had a chance to listen to the conversation. You're also the father of a son on the spectrum, an adult son, Adrian.
Yeah!
Yes, Queen.
Yeah. Yeah. It's time for Yes Talk.
Thank you.
Wow, that's very impressive. You're fast.
That's producing. That's what I do.
I know. That's great. That's great. All right. Well,
Sorry, you were saying.
Yeah. Well, no, I was just introducing you and
Yes,
kind of giving the context of why why we want to have Yas talk.
Sure.
And just kind of get some of your thoughts about the discussion and have your perspective about the topic.
Yeah. Well, where do you want me to start?
Wherever you want to start.
Well, the vaccines, I think, I don't know. I know that there are injuries because I learned from you, David, that, sometimes you got to dig a little deeper on these things because it never helps to have blinders on with anything these days.
With anything, right?
Because I think it's shutting down our country. It's like you're in, you're out, you're blue,
canceled.
Right. You're right. And so, when Adrian was diagnosed and in the years that followed, it seemed like most of the science is pointing to the fact that there was no link between vaccines and autism. I still believe that, but that doesn't mean we can't stop looking at it. And so, there's circumstantial evidence to it because of the timing of when autism symptoms tend to show themselves. And that's what gets parents, and this, I imagine this still happens, but it was sort of rampant when Adrian was a toddler. And that is that there is a cruel phenomenon in the presentation of symptoms of autism. For the first year or at least 8 months of the child's life, he or she appears to be normal and then appears to slowly fade away. Adrian was obsessed with Elmo and Sesame Street, and we thought we were letting him watch too much Elmo and Sesame Street, and we thought Elmo gave our son autism. Not really, but we were. So it was around that time, and it's around that time that you get some vaccines, and so I certainly think it's worth looking into. The theory that I like to just noodle on, even though I have, as you've been saying in the discussion, I have no evidence whatsoever on this other than, again, circumstantial evidence, is that what if the spike in the cases of autism is evolution? Right. We all know the classic is the first example of evolution I think I learned was, well, giraffes didn't always have long necks, but one day there was a mutation and a weird giraffe was born, but turns out that weird giraffe survived because the weird giraffe was able to reach the coconuts or whatever they eat up there, the leaves on the top.
Right,
and so a million years later, giraffes have super long necks. So our kids, the weird giraffes, because right now they have a hard time functioning in our society, but it could be the beginning of something, and that years down the road they'll be. And one of the things that just sort of jumps out to me, again, this is more of sort of a cosmic theory than anything based in true fact, but our country is most would agree, and not in the greatest shape in terms of social discourse, right?
That's putting it lightly. Yeah.
Yeah, we're divided. We're bullies. We're name callers. We didn't used to have problems like online bullies. We didn't used to have trolls. Trolls used to be those cute little things you collected and put on your bed, right? And so, and now come these kids like Stone and Adrian, and they don't care about Twitter feuds. They don't care. They don't even care about, at least Adrian doesn't care about getting caught in traffic, or he doesn't care about a lot of the things that really bother us. You know, there are a lot of people in our society that just, they read one tweet or they get one negative comment on their page, whatever that page may be, and it ruins their whole day. And why?
Yeah,
Because it just seems like we're more and more victims to our emotion. And kids with autism, people with autism, of course, have emotions, but
absolutely.
But it's a different ball game for them. You know, they really it takes a lot to bother Adrian. You know, and there's a sort of even keeledness in them, I think, because they see things very simply a lot of the time. And so they're not caught up in when my wife and I got divorced, it was, of course, an incredibly sad day. But and our younger son was crying, and I was crying, and my wife was crying. It was a very sad day.
Sure.
But Adrian was the only one not crying. He was saying, "So where are you going to live?" And I said, "I'm going to live in this apartment." He said, "For how many days?" And I said, "Well, probably for all the days from now on, Adrian. But you're going to come visit on these days." And he said, "Okay," and he went back to his iPad. So, I mean, maybe there's something there. Not to mention the fact that there's so many amazing things going on in their brains that I know Adrian has a couple of savant-like skills, and I know Stone has powers, if not superhuman powers.
Right.
We don't know.
Yeah, we don't know. We don't know what. Yeah, right.
So there's one little data dump there. I don't know what else. What else do you want out of Yas talk?
That book, Pattern Seekers, is exactly about this. So, for example, he talks about Thomas Edison. He's convinced that Thomas Edison was autistic, and because he was tinkering his whole life, he was tinkering. His family was always like complaining that he wasn't spending enough time with them, but he was tinkering, and he had so much energy and invented so many things. So today probably would have been
diagnosed on the spectrum, right? Yeah,
right.
level 2 diagnose, or whatever they call it now. Right.
Yeah, but I also I also don't want to minimize the challenges that I'm learning now, and
Yes.
heard your stories, and David, your I'm sure both Davids have
Right. Yeah.
stories to share on this, and I'm reading about this, and the struggles and the aggression, and the sleepless nights, and that many parents struggle with, and the sacrifices, and so I have so much respect for all of you, for this community, and it also it pains me to think that there may be some in my profession who are capitalizing on that, and who are trying to sell snake oils to this community. That's what pains me the most. And that's sort of what gets me up in the morning. How do we get the snake oils out? And by the way, if any of your listeners, if you have stories, I'm working on my book. I respect confidentiality 100%. So if any of you have stories you would like to share, please reach out. I would love to talk to folks, just really to understand, everyone's perspectives on this.
I know that I've seen some companies in the past sell at-home saunas, standalone saunas that like you put in the backyard. And I noticed some of them were being billed as treatment for autism. And if you dig a little deeper, there's nothing there. But, it is scary because, or scary is not the word. it's deplorable because parents with kids with autism will try anything. I know David and I both would. If you told me that somewhere in Madagascar they're selling a special kind of milk that if you drink it you don't have autism anymore, I'm getting my butt to Madagascar and bringing Adrian with me. You bet. But is that the sort of thing you mean by snake oil salesman?
Yeah, I would say yeah.
Yeah, I mean, something that's, I mean, the way I think about quackery is if you know something doesn't work and you're still selling it to people.
Yeah.
That to me, and we went through this period in America, the period of patent medicines in the 19th century, where the reason they were called patent is that the bottle was patented. The bottle, the name, the chemical ingredients were secret because they said, we don't want to patent them because then our competition will find out what they are. So the ingredients were secret. They would just sell you this like a baby calming medicine. If your baby's crying, give them this and they stop crying. Or the sleep medicine. So what was in them mostly? Opium and alcohol, I think, were the two ingredients.
Right.
Your baby opium, they will sleep perfectly.
They'll put you to sleep. Yeah.
All of your stomach aches will go away. So we don't want to go back to that.
Yeah, no, I think that's a great point. And it's funny, Dave, that you mentioned the milk, because I was just going to use this as an example. You're right. I was having this conversation with the practitioner who we're working with doing the brain enhancement therapy. And I think, Alex, I still need to send you some information because I think you'll find this fascinating in terms of how it's helping Stone with his apraxia. But we were talking about in general, just that whole issue, Dave, in terms of, that we'll do anything, right? And just but it's amazing, like how much misinformation, intentional or not, is out there. And I just referenced a Facebook post I saw yesterday, one of the many groups I'm in, and it was a younger mother who just had a son who was recently diagnosed, the usual things, asking for advice. And the comment section was just like the perfect example of everything that's right and wrong about this world, like an autism world right now. Like, because there's everything from, some thoughtful comments, like, here's what I found helpful with ABA therapy versus what I didn't, to someone like, well, I know this sounds funny, but try drinking camel's milk. No joke, Dave.
Really? Wow.
Yeah. And it's just like,
yep.
You just feel for the mom. I mean, because again, we've been there, right? You just get all this and you're like, what the hell? Like, how do you sort it out? How do you figure it out? And that was kind of the point of bringing Alex on here and having these discussions, because it's not easy. Again, it's not black or white. I mean, I don't think any of us claim to have the answers, but I think we're all willing to try to look at a lot of different sides and kind of feel our way through it without getting too caught up in the emotions. Like you were saying, Alex, earlier.
Amen.
All right. Well, I said, Alex, we're gonna have to do this again because there's just so much to talk about. There's a bunch of recent developments I even wanted to get into that we weren't able to in terms of the whole HHS and RFK, so we'll get that in the books. So for now, though, let's go ahead and put a wrap on this one. And I'm going to ask again the audience. So first of all, Alex, before I do that, why don't you let everyone know about your podcast as well?
Oh, thank you. Yes, it's called The Language of Evidence, which is sort of the draft title of the book. And we had a great guest recently.
Who was that?
So I still need to put that out. It's been just so busy. David, the other David, you have an open invitation. I would love to talk to you.
Thank you.
And we're hoping to get into this topic from various angles, helping people make decisions and navigating this confusing time.
Yeah, a lot going on. Well, so again, viewers, listeners, thank you for sticking around. Love to hear from you. Any thoughts, ideas, feedback you have, reach out to me. My website is davidkaufer.com, or you can email me, david.kaufer@hey.com. So Alex, thank you again for joining us. Dave, thanks for Yas Talk. And until the next time, everyone, we'll catch you on the lighter side of the spectrum.